Welcome back. Dr. Matthew Bechtold of MU Healthcare joins us now to discuss the growing number of younger Americans that are being diagnosed with colon cancer. Dr. Bechtold, good morning and thanks for joining us.
Thanks for having me.
Can you tell us why is it that more and more young Americans are being diagnosed with colon cancer?
That's a great question. I think, to be matter of fact, I don't know if we know the complete details for sure. I think that there's a lot of risk factors in the young these days, including obesity, dietary changes with red meat that can contribute to some of these colon cancer cases. But I don't think we have a good handle on it yet. It's going to take a lot more looking.
Who would you say should be getting screened when it comes to colon cancer?
Another great question. I think that right now the screening guidelines say anyone the age of 50 should start getting screened, although the American Cancer Society came out with a guideline saying that 45 might be the new age to get screened. But we have a lot of debate and a lot of talking before that becomes mainstream.
Absolutely. So if you would say there are different risks, what are those risks that could put people at risk for colon cancer?
Again, a lot of it is genetics. If you have a family history of colon cancer, especially in a first-degree relative like your mom, dad, brother, sister, son, daughter, you should be screened earlier. You should be screened at 40 or 10 years before that relative got diagnosed.
And as far as
otherwise, you stay till 50.
Okay. Tell us about the different screening options. Are there different options, or is it one set thing that everyone needs to do?
There are different screening options. Colonoscopy is one of those options. It's both diagnostic and therapeutic. You can see these precancerous polyps. You can remove them before you get to a cancer. The other screening tests are stool-based tests where they check for blood or certain types of DNA in your stool that advanced polyps and cancer might shed to help look for the colon cancer that way.
Okay, Dr. Matthew Bechtold, thank you so much for joining us bright and early this morning. And now we are going to send it over to the newsroom.